Hello, my name is Becca Rusk, and today I will be talking about Meige's syndrome. Meige's syndrome is a rare idiopathic neurological disease characterized by repetitive eye blinking and abnormal facial movement. It is a type of focal dystonia. Dystonia is characterized by abnormal involuntary movements. It is a combination of blepharospasm, which is involuntary eye blinking, and oromandibular dystonia, which is the involuntary movement of the jaw, tongue, and mouth. This disease is often misdiagnosed as either blepharospasm, oromandibular dystonia, or a purely psychiatric condition, such as conversion hysteria or tardive dyskinesia, both of which have involuntary movements. In the upper right-hand corner, we have an individual that is presenting with both oromandibular dystonia and blepharospasm. This disease goes by a multitude of other names, as you can see here. It typically occurs in individuals over 40 years of age, and women are twice as likely to contract this disease than men are. This diagnosis is made on the basis of external signs. No specialized tests or examination to confirm the diagnosis exists. The presenting signs and symptoms are what we talked about a little bit earlier. Blepharospasm, which is the involuntary contraction of the orbicularis oculi muscles, causes involuntary closing of the eyes. This can last anywhere from a few seconds to 20 minutes and can render an individual functionally blind. Oromandibular dystonia are involuntary and typically forceful contractions of the muscles of the jaw and tongue. These symptoms can fluctuate considerably from day to day and can be aggravated by different things, such as stress, fatigue, or actions. This is also known as action dystonia. Certain muscles, especially within the laryngeal, pharyngeal, and neck muscles, can be progressively worse. Symptoms typically improve with sedation and disappear during sleep. Here we have two individuals presenting with the signs of Meige's disease. On the left, the woman has eye closure and involuntary closure of the mouth. On the right, the individual is displaying involuntary opening of the mouth. The neuropathology of Meige's disease. While the exact etiology is unknown, there are quite a few theories for what is happening in this disease. Lesions have been found in the basal ganglia, diencephalon, and upper brain stem. It has also been proposed that an abnormality in basal ganglia functioning may be due to the body's inability to process neurotransmitters. Hyperactivity of dopamine and acetylcholine is also a theory. This disease can be induced by neuroleptic drugs, such as those used to treat Parkinson's disease. Speech impairment varies depending on the primary muscle groups affected for individuals with Meige's disease. They will exhibit adductor spasmodic dysphonia, which will result in voice stoppages as they are talking. The most significantly affected subsystems are phonation, articulation, and prosody. The most severe is going to be imprecise consonants, vocal harshness, distorted vowels, articulatory breakdowns, slow speaking rate, strained strangled, voice stoppages, short phrases, and excessive loudness. As you can see here, we have broken up the speech characteristics into their subsystems. Resonance is going to be the least effective, with a possibility of mild hypernasality. Respiration will also not be affected much unless the involuntary contractions of the body are affecting the muscles of respiration. Impairments that can go along with this disease include dystonia in the extremities, trunk, and neck. Other problems, such as ocular problems, can include eye infection, trauma, functional blindness, and dry eye. There can be dental problems, such as TMJ syndrome and jaw malocclusion. Hyperkinetic dysarthria is a result, as well as difficulty swallowing. Meige syndrome has been associated with autoimmune disorders, thyroid disease, a variety of psychiatric disorders such as depression, anxiety, OCD, and stress. Although there is no cure for Meige's disease, there are many treatments available to help alleviate symptoms. Drug therapy has been helpful in about 1/3 of patients. The most common drugs are listed here. However, this process may have to result from a combination of medications in order to find the one that will best relieve the individual of their symptoms. Oftentimes, this is a process of over a year trying to determine what is the best medication for the individual, or rather combination of medications. Injections of botulinum toxins, also known as Botox, can also be a viable treatment. The results depend on accurate targeting of affected muscles and the appropriate amount of toxin. However, a patient may need to see multiple doctors in order to get Botox in all of the areas where their spasms are occurring. Botox injections are effective in approximately 50% of patients. Deep brain stimulation may be a final resort for individuals whom Botox and medication did not work. Deep brain stimulation is a process where electrodes are inserted into the internal segment of the globus pallidus of the brain. Benefits typically develop gradually over several months. However, there is a small risk of stroke, infection, development of new neurological signs, including visual field deficits or mild worsening of motor functioning. In a study performed by Bloomstead and colleagues in 2008, a 41-year-old male who presented with a severe right arm tremor as long as the other symptoms of Meige's initially used Botox. It was successful at first, but his condition deteriorated. Eyelid closure was present greater than 50% of the time. Deep brain stimulation was used initially in the top left was before implementation. The patient was instructed to follow the line that is presented on the paper in each of the drawings. 1.5 years after implementation of the electrodes, the patient was able to draw much clearly. There is a significant improvement in this patient's functioning, both mentally and physically. Another case study performed by Meige et al. In 2010 was done using a 49-year-old woman. She was rendered functionally blind, was unable to work at her job, was socially isolated because of her condition, and lost interest in all activity. After bilateral deep brain stimulation, the patient severely improved immediately as well. As you can see on the left hand, this is a picture of the patient before deep brain stimulation, and on the bottom, the patient is able to see with no spasms in the eye or the mouth. Other treatment strategies can include sensory tricks, which will essentially trick your body into not having the involuntary movements. These can include biting a toothpick, touching the face, whistling, humming, singing. It will depend on the individual. However, these will not last forever. Bite blocks can also be used to help stabilize the jaw, and psychiatric therapies such as hypnosis, psychotherapy, desensitization, sedatives, antidepressants can have little impact on the dystonia itself, but may benefit the patient in reducing anxiety. Speech treatment, easy onset of phonation for involuntary laryngeal movements can be beneficial. Here are some education and resources for families that may have Meige's disease and my references. Thank you.